busy. So just thank you for coming. So for my project, I had to educate either coworkers, family, friends, somebody on a Healthy People 2020 goal. Has anyone heard of Healthy People 2020 before?
Yeah.
Yes. Does anyone know anything about it? Just throw some stuff out there.
It's like goals set by the federal government to like get, I know one of them's like getting obesity down or something.
Right. So Healthy People 2020, every 10 years, they set new health initiatives for the United States. So we had to make a presentation for one of those goals. So my goal that I chose was to educate oncology nurses on the goal of health-related quality of life and well-being. I feel like here we've had a lot of education on different things, but I never have remembered one education session being on self-care or anything for us. Mm-hmm. So I thought I would take this opportunity to educate everybody on that because I think it's something we could all really benefit from. So my goals are to educate you on that goal and for you guys to understand how stress can impact your physical and mental health as well as quality of life. And I will also provide resources that will enable nurses to be proactive in managing their own health quality of life. So we kind of talked about Healthy People 2020. It's a health initiative that is science-based that creates 10-year national objective or goals for the health of American. It also encourages collaboration among healthcare providers and community. One of their big goals is for our patients to be partners with us and to take initiative in their own health and to be partners with us in healthcare. And they also are measuring the impact. We have all these prevention activities that we are creating, so they're measuring if those are working or not. Other goals for Healthy People 2020 to live longer and healthier lives that are free of preventable injury and diseases, to achieve health equality and to remove health disparity, and to create positive and healthy environments for all ages. So my specific goal, the health-related quality of life, it includes 4 domains of functioning: mental, physical, emotional, and social. Well-being can be defined as a state that includes all 4 domains of functioning that supports a person to live a full, satisfying, and productive life. So these are just some definitions. Well-being, we just discussed that. They also measure your participation. So your well-being, they look at if you are active in education, employment, social activities. And then what they do is they measure your self-rated physical health. They give you a questionnaire and they see if you feel that you are living a healthier life before they've placed interventions as opposed to after. Stress, what is it? Okay, so stress, it's inevitable, unavoidable, and characterized by a rapid or sudden change. It places non-specific response from the body to demands, causes changes in the body's homeostasis, which is the internal conditions that are needed for survival, and it affects the allostasis, and that is just how the body tries to attempt to get yourself back to homeostasis. So if you're experiencing a lot of stress, your fight or flight will activate. So these are just some symptoms that happen with fight or flight: heart rate increase, shaking, dry mouth, tunnel vision, flushed face, memory loss, slow digestion, and dilated pupils. So just a little bit about allostasis. So that, again, is how your body gets back to normal, to the internal conditions. So when your stress has ended, your body is normally able to go back to the normal state. But when you have this continued stress, it causes what's called allostatic overload. And it starts to cause the negative effects on your body. An increased or a continued allostatic load will increase your risk for diseases such as cancer, heart disease, and diabetes. So one study I looked at, 75% of people that work in healthcare that went to their primary care provider, their symptoms were exacerbated by stress, or their visit was somehow related to increased stress that they might be going through at the time. So it also causes decreased life satisfaction, development of mental health disorders such as anxiety or depression, also causes things as increased risk for heart disease, diabetes, and it decreases your immunologic function. So oncology nursing, how does it impact us? So a bunch of things I read showed how oncology nursing, because of the deep rapport that we build with our patient and families, it's almost an intrinsic thing that we naturally get close to our patients. So we are particularly vulnerable to occupational stress because of the care that we provide. And that is because this deep rapport that we have with our patients and families, it causes just increased grief burden and emotional distress. It causes role conflict. We're supposed to deliver this compassionate care and be there for them, and in that time we've gotten so close to them. And then when things don't go well, which how often does that happen here, so then we have to also protect our own emotions, but that's hard to do when these people become almost like family members. So triggers for increased stress levels in oncology: traumatic events such as colds or deaths with prolonged suffering, institutional or political constraints, lack of resources and support, increased workload due to staffing shortages, and increased patient acuity. Burnout. So burnout is a prolonged response to chronic stressors that result in exhaustion and ineffectiveness. This occurs when a nurse cannot achieve a set goal that she plans to provide for her patient. It then leads to frustration and perceived lack of control. Burnout is environmentally driven. It usually has a rapid onset and resolution. It leads to things such as exhaustion, pessimism, anxiety, and decreased work performance. So then compassion fatigue is something that comes from burnout. It's a combination of burnout and secondary traumatic stress. So it can be acute or gradual onset, but compassion fatigue has more long-term negative consequences. It arises from a natural and intrinsic response from within. It's like the rescue caretaking. We want to take care of our patients. And it occurs when we cannot protect them from harm, and it results in feelings of guilt and distress. So what comes from this burnout and compassion fatigue? Emotional and physical illness, distress symptoms including headache, increased blood pressure, fatigue, weight gain, trouble sleeping, and anger. It results in decreased quality of life, both social, physical, mental, and emotional. So without proper interventions to moderate this stress, maladaptive mechanisms to cope will occur. So I would just like to take a minute to discuss just about certain stressors that we may see here for oncology. I know one situation I was talking about earlier today was when we were caring for a young guy, a 26-year-old, who was dying. It was a sudden death. His children were in the bed, his family, 20 to 30 people in the room with him. I lauded as he took his last breath, and I watched the family all watch him take his last breath, and it was just very traumatic. I was a newer nurse at the time. I had the kids in the bed crying. It was just very hard. So after that, I feel like I was very emotionally withdrawn, and I had a hard time even getting through my shift. But I feel like a lot of studies show that us being able to talk about that with each other, also it reduces our emotional burden and just helps us cope a little bit better. So is there anybody else who has an experience like this that they might like to talk about?
I mean, just in general, the families are a lot to handle sometimes because we get to know them so well, and we're pulled in several directions, and if we have multiple families that are all here at the same time coming to you for things, that can just be a lot too.
Right.
I think one of the biggest stressors for me is when you're dealing with a patient who is actively dying and you're trying to be there for the patient and for the family, yet maybe 1 or 2 rooms over, another patient just got the very good news that they're in remission. So you have to switch your emotions from one room to another in a very short period of time, which plays on your emotions because you have to suppress how you really feel as far as the sadness and the heaviness that you feel regarding the patient who's going to die, and then the happiness for the person who has made it through their rounds of chemotherapy. It's very stressful to me.
I think that's hard, and I think we've seen people become friends here too. And when one does good and one doesn't, that's very hard to watch.
It's very
that
we
happen.
have that happening lately too.
Yeah. All right. Well, thank you for all sharing. So the big things that impact stress at work, one of the best ways for nurses, they say, to cope with this environment is for team cohesiveness. It directly impacts the level of burnout. The culture of teamwork, it also has multiple other benefits, including effective mentoring of new nurses and positive leadership. Younger and less experienced nurses have a much higher risk for burnout and fatigue, so a supportive environment for them is crucial, so we don't have all the high rates of turnover. Workplace intervention, that we can have guidance from more experienced nurses, resources, the more resources available to a staff, the better. Acknowledging individual grieving patterns and coping mechanisms, and acknowledgement from leadership. It goes a long way when leadership acknowledges the grief and stress that you go through, and for them to make it known to you that there are resources available if you do need them. Other things that have really helped nurses with stress and self-care: training specified to death, ethical and moral dilemma and grief, which is something I don't think we've had here ever, I don't think. So that's something that is really shown to have good effects. Allowing promotional expression, continued education. They do have special nursing retreats for stuff like this, and peer support. Interventions or approaches to stress management. Minimizing stressful events. If you can, try to minimize the stressful situations. That's always fast. Changing your environment, avoiding too much change at once, and good time management. Increasing resistance to stress, promoting exercise, enhancing self-esteem, and time management. And avoiding physical or physiological arousal to stress. Workplace intervention, considerations continued. Training specified to death, ethical and moral dilemma, and grief. Oh, I already said that one, sorry. Increasing assertiveness, building coping resources, and setting realistic goals are also a way. Complementary therapies used by 2/3 of the population. Relaxation, yoga, mindfulness. Those are just some of the complementary therapies that are really good for stress management. The results of proper stress management include improved quality of life, improved relationship with your family, peers, and coworkers, and reduce risk of illness, including mental illness. Albany Medical Center resources. We have very specific resources here available to us for free if we so need them. Pastoral care, employee assistance. They can help with stuff like personal, emotional, financial, professional, any kind of crisis. They have licensed social worker available to you. And I do have handouts for you all if you want to take one. They have a full list of multiple resources if you do need them. We also have the Healing Arts program here that we can use by appointment. If you call this number here that's on the paper, they will make appointments for you. We also have the on-site fitness center for $5. On the handout, you'll also find some state and national nursing supports. The New York Nurses Association, they have counseling service, mental health services, addiction services, and They can also help you with any practice safety concerns. If you feel like something is really not safe, they can help you find support to deal with that. The American Nurses Association is another national nursing association that has program initiatives such as Healthy Nurse, Healthy Nation. Just gives you ideas on how to lead a healthier life. And that is all. I would like to thank you all for coming to my presentation. Please fill out the postcast. And lastly, always remember to care for yourself, because we can't care for others if we are not healthy. And that's it. Thank you.
Very nice.
Good job.
Well done.
Thank you,
Well done.
guys.
Thomas wanted to